have any more questions or concerns?
Well, my wife and I were thinking about having a child.
Oh, that's great. Is there anything you wanted to discuss?
Actually, there is. I know hemophilia is genetic, so I wasn't sure what kind of risk I'd be putting my child in.
That's right, hemophilia is indeed hereditary. Therefore, there's always a risk of it being passed on. However, it depends on your wife's genetic code as well, and if she's a carrier of the gene.
Oh, I didn't know that.
Are there any other diseases in your family?
Well, my wife's grandmother did pass away because of ovarian cancer.
I'm sorry to hear that. I think it would be beneficial for you to talk to a specialist about your concerns. Would you like me to refer you to a genetic counselor?
What's a genetic counselor?
A genetic counselor is another healthcare professional who specializes in interpreting genetic information to determine the likelihood of inherited diseases and other medical conditions. A genetic counselor can evaluate your family medical history and figure out the potential risk your child may have.
Wow, that sounds exactly like what we need.
Perfect. I'll write you up a referral right now to Kate Chobanoff. She's great.
Thank you so much.
Here you go.
Thank you.
Do you have anything else I can help you with?
Nope, not right now.
All right. Well, it was nice seeing you. Call me if you have any other concerns.
Will do. Thank you.
Hello?
Hey, honey. I just talked to my doctor about us having a child.
Oh, really? What did you say?
I mentioned that we were concerned about the risk of having a child because of me having hemophilia and because of your grandmother.
What did the doctor say?
He said there was a risk, but he referred us to a genetic counselor for more information and testing.
Oh, a genetic counselor. I heard of that. My friend Becky went to one. When do you want to schedule an appointment?
We can figure that out when we get home. See you soon. Love you.
Okay, see you. Love you too. I hope everything works out okay.
Madison and Alexis. Hi, it's so nice to meet you. I'm Kate Chobanoff. I'm Madison. Hello. It is so nice to meet you. Dr. Adams told me you were coming and that you had concerns about having a child with your history. Why don't you both tell me a little bit about yourselves?
Well, I'm 32 years old and I've had hemophilia my whole life, but neither of my parents had hemophilia. I'm currently on desmopressin to help clot my blood, and I receive placement therapy every so often to maintain my blood volume. Besides that, everything else about me has been pretty good so far.
Interesting. I'm glad to hear you're doing well. And how about you, Alexis?
Well, I'm 31 years old, and as far as I know, I haven't really had any serious health problems.
What's your family medical history like?
Well, my mom doesn't have any problems either that I know of, but my grandmother did pass away from ovarian cancer when I was younger. Because of that, my mom and I get regular checks at the gynecologist.
It's good to hear that you're trying to be proactive. May I have your gynecologist's contact information?
Oh yeah, sure. Her name is Dr. Yam, and here is her phone number.
Great, thank you. And I have already talked to your primary care physician.
So, where do we go from here?
Well, based on your concerns and what you've told me, I recommend that you, Alexis, get 2 blood tests. One for hemophilia and one for ovarian cancer. I also like to talk more to your gynecologist.
So, why do you need to test me for hemophilia if I don't have it?
Hemophilia is an X-linked recessive genetic disorder. This means that a boy will need 1 copy of the hemophilia gene, whereas a girl will need 2 copies of the gene to exhibit the traits. As a female, even though you don't have hemophilia, you still be carrying the gene on one of your X chromosomes. This would make you a hemophilia gene carrier. Madison's mom was a hemophilia carrier, which is why Madison has hemophilia.
How do you know my mom was a carrier?
Since you got your Y chromosome from your father, we know your X chromosome has to be from your mother, which means she had hemophilia gene but didn't exhibit traits of the gene because she only had 1.
Oh, okay, I understand.
Therefore, if Alexis has the gene, your child may be at risk for hemophilia.
Okay, we understand.
So I'm going to have you, Alexis, get both blood tests, and I will talk to your doctors. Once I get the results, we can schedule a follow-up appointment. And is there anything else you'd like to discuss today?
I think that's it.
Well, it was great meeting you, and I look forward to seeing you two again. Here's your referral.
Thank you so much.
Thank you. See you
See you
soon.
soon.
Hello, Dr. Yam. This is Kate Chobanoff. I'm calling to inquire about one of your patients, Alexis Cow.
Hi, Kate. Nice to hear from you. What would you like to know?
Today I had a meeting with Alexis and her husband about the potential risks there are if they were to have a child. Alexis informed me that her grandmother passed away from ovarian cancer. I have faxed Alexis's consent for you to share her information with me. I wanted to check in with you about her current health status.
Yes. Alexis mentioned she was thinking about having a child at her last appointment. I will pull up her files now.
Great, thank you.
Yes, just as I recall, Alexis has had great health her entire time with me. All of her tests have always been clear, and she has never had any physical abnormalities or other characteristics that would concern me. She comes in every 6 months to note any changes, and so far she has had none. I will fax you all of her exam and test results.
Excellent, thank you very much. If any significant information arises, please contact me.
You're welcome, and I will. Goodbye.
Hello?
Hi, Kate. I have your results from Alex's blood test. It turns out Alex, her CA125 protein levels are normal, as well as her BRCA1 and her BRCA2 genes are also normal and don't show any signs of mutation.
Great, I will pull them up now. So it looks like Alexis does not have a predisposition to ovarian cancer.
Yes, that would be correct. Her APTT test showed that her factor VIII activity were lower than normal. Her levels was less than 50%. It came in at 47%, which qualifies for moderate hemophilia. As well as her ratio of factor VIII coagulant activity to her concentration of VWF antigen was less than 0.7.
So she's a carrier of hemophilia?
Yes, and since the father has hemophilia, if they were to get pregnant with a girl, she has a great chance of having hemophilia as well. But she will automatically be a carrier. Having a boy, he will have equal chances as well, since the mother is a carrier.
Okay, thank you.
Just before you go, there's one more thing. If they decide to go through a pregnancy, I will recommend prenatal testing during the 10 to 12 week gestation period for chronic villus, sampling, or at 16 to 20 weeks gestation to obtain fetal cells for DNA to do a linkage study. The last option would to wait until week 20 and obtain blood for factor VIII levels. But the mother is at risk for having symptoms of hemophilia as well during her delivery, since she is a carrier.
Okay, I appreciate your insight and we'll be able to go over everything with the patients. Thank you. Goodbye.
No problem, anytime.
Hi guys, welcome back.
Hello, how have you been?
I'm well. How about you two?
We're doing well, just a little nervous about what we're going to hear today.
I see. Let's get started with that right now. So I talked to your gynecologist earlier, and based on the information she sent me, I constructed a pedigree to show you any health conditions your child may have. So Alexis, good news is that you do not have a predisposition to ovarian cancer. This means that you will not be passing on any mutated genes to your child. Since you do not have a predisposition, your mother likely did not as well. With that said, ovarian cancer does not appear to be genetic. In other words, it does not run in your family. Your grandmother likely developed ovarian cancer from environmental factors, and fortunately, it did not pass a mutation to you.
Oh, good. I'm glad to hear that.
Yes, that is good. On the other hand, though, your lab results have informed me that you are indeed a carrier of hemophilia.
So, does that mean our child will inherit hemophilia?
Possibly because you have hemophilia in Addison. As we discussed before, if you have a son, then there's a 50-50 chance you will have hemophilia depending on if he inherits one of your wife's X chromosome that has the hemophilia gene. If he gets X chromosome with no hemophilia on it and it has your Y chromosome, then he will not have hemophilia.
What if we have a daughter?
So the daughter will have at least one chromosome with the hemophilia gene because it's coming from you, Madison.
But again, it comes down to whether or not the child gets X chromosome with a hemophilia gene on, or the X chromosome with no hemophilia gene from Alexis. If she gets one with no hemophilia gene, then she will just be a carrier and not have the symptoms. If she gets one with the hemophilia gene, then she will have hemophilia. Do you want to see the pedigree outlines this for you guys? So here, and just trace this all the way down.
So there's an equal chance of our child having hemophilia and not having it?
I wonder what we're going to do.
I think you should think on it for a while and consider what you should do if the child does have hemophilia, now that you know the possibilities and risks.
Okay, thank you so much. We can talk about everything.
Thank you.
See you guys later.
Bye.
Living with hemophilia has been very difficult at times. I'm blessed to be alive and living a pretty regular life, but I don't know if I want to risk potentially having a child who will also have to suffer the way I have. Getting transfusions and constantly taking tons of medicine isn't what I necessarily want for our child.
Well, there's always a chance that the child wouldn't have hemophilia, though. Or we can always adopt. What do you think?